looking at um, different epigenetic type of products and, searching my opinion on what they should start with. And then more recently, we just moved from Oregon to Idaho, and the only thing I'm licensed at today is I'm now an Idaho real estate agent. So I got a little bored not doing anything during the coronavirus issues, and so I decided to take some classes to keep me busy, and now I'm out on occasion trying to sell some real estate. So that's where I'm at. So if we can get the slide presentation up, I'm not sure who's running that. Perfect. And then go ahead to the next slide. So we're gonna, we can go past that. All right, so when the third product reached, a group of us kind of got together and we're trying to come up with a concept of how these three products work together. We knew the science of each of them, and we knew that each of the strengths of these three products had a benefit that when used together, it ended up in this trifecta. And obviously we got that from the horse races. You can place some money on a horse to bet first, or to place first or second or third, or if you're really wanting to reach out there, you can try to guess which three horses are going to place in first, second, and third. That concept of knowing how three horses are going to do is really what we were looking at these products. We knew what each of them could do individually, but how do they function together? And that's what we're going to talk about tonight. Let's go to the next slide. So we know our three products: Genomics, an NRF2 activator; Link, which is an outstanding gut health product. It also is an NRF2 activator. Optimend, which is our anti-inflammatory, antioxidant product. So we're going to talk about each of these kind of individually just a little bit, and then I'm going to talk how the three of them are functioning maybe together. So let's go to the next slide. So NRF2, most of you should be familiar with what NRF2, it's a product that we've had down in Mexico, was the first product released, and we're now able to get it in when we buy the trifecta packaging. We get the Genomics for free. As an NRF2 activator, we know that through the studies that the manufacturer, not the manufacturer, but the designer of this formula has shown that this particular formula kind of outshines all of the NRF2 products on the market today. So we know that it's upregulating some 3,500 genes in our DNA, in our cellular function. We know that it has effect by upregulating the autoimmune system, that it's reducing oxidative stress, it's reducing inflammation, and it's fighting all the aging processes, if you will. And it's doing that by simply upregulating genes that have slowed down just because of the aging process. Let's go to the next one. So Link, another epigenetic product. Primary design is to improve the gut health, but we know from lots of studies out there that the gut is essentially the second brain. There's a communication between our brain and the gut biome, which help regulate a number of systems throughout the body, but there's a very correlated connection with the brain itself. We also know that the primary ingredient in Link, being butyric acid, is a is the primary food source for the cells that line the gut walls. So from the beginning of the small intestine to the end of the colon, all of the tissue that surrounds the inside of the lining requires short chain fatty acid as its primary food source. And we know there's 5 or 6 different short chain fatty acids, but these cells require 70% of their food source or their energy source to come from butyric acid. And this is a primary reason why Link has been so successful in gut health issues. Is not only is it improving the gut biome, but it's improving the overall health of the cells that line the entire gut system. Let's go to the next one. Next slide. So we're missing one. Optimend, I'm sorry. I thought it was still on Link. Optimend is an incredible product. If you've done any research looking at the 2 primary ingredients, we know that turmeric is a super anti-inflammatory, anti-pain type of product, but this particular product is using the broken down portion. That is, when your body takes in turmeric, it'll eventually break it down to what we start with this product, and that is tetrahydrocurcumin, which is a more pure form of the turmeric product. It's also coupled with another well-known anti-inflammatory antioxidant product, and that is Boswellia serrata. So the two combined together, we have seen research that shows that when they're combined, they get almost a 10-fold increase in their ability to reduce oxidative stress and reduce inflammation. So we know that just about all disease processes have inflammation as one of its chronic concerns for that pathology. We also know that oxidative stress is the primary reason why we have an aging process where cells starting to weaken, where our gene process starts slowing down, and where disease processes start up is because it's being triggered by oxidative stress. Optimend is truly one of the strongest products on the market today that can help reduce some of those functions. Now let's go to the next slide. So here's where it comes together. When I talk about the trifecta of products, I talk about each of them having a particular strength, and I just lightly touched on it as we went through each of these products independently. But not only do they have their strength, there may be some overlap as as we go into another slide here coming up. I'll show a number of disease processes that science is telling us the herbs used in these types of products, what they're good for. That is, what kind of disease processes out there may be benefited if you're taking these kind of herbal products. And so that's where that overlap comes, is that they are supporting each other by the individual strength they have and what they can do, but they're also providing a little extra benefit from the strength of one of the other, or possibly both of the other 2 products. So starting with, we know that at the root of disease is oxidative stress and inflammation. I've just talked about that briefly. Genomics, Link, and Optimend, these formulas work through different methods to strengthen the overall protective approach to our cellular health. And each of these products provide multiple unique cellular benefits that interact as well as provide duplication of coverage for your cellular health. And let's go into that a little bit further. Let's see the next slide. So when we look at them, this is kind of maybe a little bit redundant. We know that NRF2, or the genomics, is a NRF2 activator. It's regulating anti-inflammatory, antioxidant genes, glutathione, catalase levels. It reduces the risk factors for diseases that are typically triggered by inflammation and oxidative stress. We know that Link is a good, strong gut health product, also known to have benefit with neurodegenerative disorders. And it too is an anti-inflammatory, and as I said earlier, it's known to be a good NRF2 activator as well. Not to compare to the strength of genomics by any means. Optimed, beneficial anti-inflammatory pain management product. There's a study out of India that shows this combination of tetrahydrocurcumin and Boswellia serrata was matched up with a prescription type of pain medication, and the results that this study was based on arthritic knee patients, and results that the study showed is that this combination of herbs together outperform that prescriptive medication. So let's go to the next one. So here's where we're going to start to see maybe a little better focus of the crossover or the added benefits that one product may be strong in, another may be not as strong in, but still providing some of that. And you're going to see as I run through some of these disorders that there's some duplication under each of these particular three areas. So NRF2 activation, we know cardiovascular disease, irritable bowel syndrome or irritable bowel disease, good for ophthalmology, for eye disorders. Oxidative stress is horrible in the vision marketplace. Why NRF2 hasn't hit that industry, I have no clue, to be honest with you. It's probably the single best herbal product on the market that can be used for ophthalmology concerns. Obesity, neurological disorders, nerve damage, kidney disease, inflammation, diabetes, depression, and cancer. You can find a myriad of research study on PubMed if you type in NRF2 and any one of these diseases. In fact, I'll get people asking me questions about these three products, and I'll simply tell them, well, get your support from the literature, and I'll send them to PubMed, and you can type any disease you want. If you want to know if NRF2 is going to be helpful for it, type the disease and put in NRF2 activation behind it, or just NRF2, and you'll undoubtedly find a number of research studies that will support an NRF2 activator to the disease that you're looking at. Same thing with butyric acid. The diseases that we know are functioning well with the use of butyric acid are, again, IBS, irritable bowel disease, Crohn's disease, colon cancer. A lot of research on colon cancer and butyric acid. Diabetes, metabolic disorder, neurological disorders, Alzheimer's, Parkinson's, autism, inflammation, cancer. Again, you can go to PubMed, type in butyric acid in any disease process and see if there's research that has been done on it. Very likely you'll see that. Not as many studies on PubMed when you're looking at combining tetrahydrocurcumin and Boswellia serrata, but there are a few. But you can also break it down and just type in tetrahydrocurcumin and see what type of research is around that. And you can look at the same by typing in Boswellia serrata. Both of them have a number of studies talking about their anti-inflammatory, antioxidant principles and how they benefit the disease process. So again, looking at different issues here: respiratory infection, sinus infections, flu symptoms, allergies, asthma, antibacterial, nerve damage, antiviral, CSU infections, and cancer. So they all have cancer in there. They all have diabetes in there. They all have neurological disorders in there. So it's pretty easy with this one slide to get an idea just how beneficial these products are independently, but 3 times, if not greater than that, when used together, because we're now fighting the whole body system. When we talk about, especially when we talk about inflammation, you can smash your thumb with a hammer and the pain is excruciating. And it's primary that you have just developed a isolated spot of inflammation. And so the blood is flowing to that system, trying to put in enough antioxidants in there to be able to reduce an anti-inflammatory, to reduce that inflammation and get that system healing as well as quickly as possible. You get that same thing with arthritic issues, only now it's becoming more of a systemic issue. It's something that is there almost 24/7. So when we can provide products that can attack the body from a systemic approach to reduce inflammation, now we're looking at a product that can do something. When I talk to other physicians about these products and why I think they're so beneficial, I talk about them about getting the body back into a healthy state. Most doctors will take a patient into their office and they're going to try to find out what's wrong, and they're going to try to find the right Band-Aid to fix what the problem is. They haven't addressed anything to do with that patient's overall cellular health. And that's where these products come in. I try to convince physicians that they should be putting a patient on these 3 products day one when you first get them in your office. Get that systemic inflammation down, get that gut system back in order, get the gene upregulations back to levels that the body can assist that physician in doing the healing process the body needs. And all of that is so, to me, so common sense, and yet it's not something that I've been easily able to get other physicians to understand and to deal with. Let's go to the next slide. So in conclusion, if you want to optimize your body's cellular function, the trifecta approach with Genomics Link and OptiMed will provide maximum cellular health. And this is so true. I get a number of distributors that will approach me and ask me questions about specific diseases. I'm not a licensed physician, so I don't practice anymore. And so when I give recommendations, it's on my science background, not on any kind of medical certificate that I may have had or in the past and no longer do. But it's very clear that if we can allow the body to get to a point where it is healthy and it's functioning at a level where it should be, you start with the gut. If you can get the gut healed, the physician may have other medications they want that patient to take. If you have irritable bowel syndrome or leaky gut syndrome, then how well is that medication going to be absorbed into the body? It isn't. It's not going to be absorbed at the levels that the scientists that develop those formulas want the body to have in order to do the healing process that it's looking for. If a patient already has systemic inflammation throughout the body, they're feeling pretty miserable. Get that body back to where it's feeling healthy, so that and by upregulating the gene processes, so that the cells can be involved in the healing process of whatever disease the patient may have. So when I'm asked what product is going to be best for a particular disease, which I get that question over and over again, I simply say, if the patient has been diagnosed with something, they're already gone too far. And just giving them one product to try to put out a fire isn't gonna likely be a lot of help. But you can slow down disease processes significantly for sometimes for a pretty long period of time, just by keeping the body healthy at the cellular level. And these 3 products are, in my opinion, the best things that are on the market today to be able to achieve those goals. And with that, I'll close it off.
All right, well, thank you, Dr. Martin. What a
My
great presentation.
pleasure. Thank you.
Since we don't have, I wasn't able to put the raffle spin wheel together, we're going to do something a little different. So Dr. Martin, I'm going to have you select a number between 1 and 22. And then I have the list of people on the side here. So that's the person that's going to receive the 60 reward points for tonight.
Well, I played about 40 years of baseball. My jersey number was always 11. So let's go with that.
All right, 1, 2, 3, 4, 5, 6, 7, 8.
That's my
9,
lucky number, Dr. Martin.
10, 11. Jocelyn. All right, Jocelyn is our lucky winner tonight. So congratulations, Jocelyn.
Hey,
I'll
Jocelyn,
put 60 reward points on your account. So
I can't believe I won something. That's insane. Thank you very much.
You're welcome.